Welcome to HormoneCyclopedia. I'm Dr. Richard Nkwenti, a hormone restoration pharmacist and compounding pharmacist with a master's and PhD in integrative medicine. As a fellow in anti-aging, metabolic, and functional medicine, I'm passionate about bringing you cutting-edge insights in healthcare. Today's video podcast delves into the critical issue of breast cancer misdiagnosis and overdiagnosis and its profound impact on society. We'll be examining a thought-provoking article from the journal Current Oncology, which challenges our understanding of breast cancer chemoprevention trials. We'll explore questions like, are antiestrogen agents like tamoxifen truly preventing life-threatening cancers? Could overdiagnosis explain why we're seeing reduced breast cancer incidence but not improved survival rates? And what changes do we need in future studies to better assess these issues? If you're interested in staying informed about the latest developments in hormone health, cancer research, and integrative medicine, make sure to subscribe to HormoneCyclopedia. Hit that subscribe button and bell icon to never miss an update on these crucial health topics. Your journey to better understanding and managing your health starts here. Let's dive in.
Okay, so you're interested in breast cancer prevention, right? And you keep hearing about these medications like tamoxifen.
Yeah.
And they sound promising, don't they? Especially for reducing the chances of getting, estrogen receptor positive breast cancer. But
Right.
there's this weird thing, this sort of puzzle we need to talk about.
Yeah, there is. And that's a big one. It's like these medications, they can really lower the number of people who get this kind of breast cancer.
Right.
But, and this is the confusing part, the research isn't super clear on whether those same medications actually prevent people from dying from breast cancer.
Yeah, that's the thing, right? Like if these medications can really stop the disease in its tracks,
Right.
why aren't we seeing a really obvious impact on the death rates?
Well, one possible answer, and it might surprise you, is what if the trials are picking up on cancers that never would have been a problem? Like they wouldn't have been life-threatening, It's called overdiagnosis. It's like, what if we're stopping cancers that didn't need stopping? And maybe that's muddying the waters of these results.
Okay, hold on. Let's unpack this whole overdiagnosis thing because it feels kind of important.
Oh, it is. Definitely. Think about it this way. What if your body is already kind of keeping certain tiny cancers under control? Like it has a system, right? Almost like it's self-regulating. Overdiagnosis, especially with mammograms, might be picking up on these super tiny cancers that wouldn't have actually hurt you.
So we're potentially creating cancers that might have just, disappeared on their own.
Potentially, yeah.
Yeah.
And get this, there's actually a fascinating historical example. Remember HRT hormone replacement therapy? Back in the early 2000s, there were all those concerns, right?
Yeah.
Well, when people stopped using HRT as much, breast cancer rates dropped. Like really suddenly.
Really?
And way faster than anyone could explain just from preventing new cancers. So some people think those HRT-fueled cancers, some of them might just naturally regress when people stop the HRT.
Wow. So could the same thing be happening in these prevention trials? Since they're messing with estrogen, maybe some cancers that weren't going to be an issue are just going away.
That's the million-dollar question, isn't it? It makes you wonder, is the reduction in deaths we see in some trials because the meds are really working?
Right.
Or are we just catching cancers earlier that weren't going to be a problem anyway?
Okay, that is a huge difference. So how do we even start figuring that out?
Well, that's where the research gets super interesting. There's this paper in Current Oncology, and they did a deep dive into all the data from lots of different breast cancer prevention trials.
Okay.
And they were trying to find any hints about overdiagnosis, but they ran into a problem. A lot of these trials, they didn't say how they found the cancers in the first place.
You mean like, did they find it on a mammogram? Or did the woman actually feel a lump?
Exactly. And that matters, right? Because like we were saying, mammograms are more likely to find those overdiagnosed cases, the ones that might never have been a big deal.
Right, that makes sense. So where does this paper fit in then?
Well, there's one trial, the 1998 National Surgical Adjuvant Breast and Bowel Project trial.
Okay.
And they did keep track of that detail. And that's where we start to see this overdiagnosis thing become a bit clearer.
Okay, now you've got me really curious. What did they do differently? And what did they find?
This is where it gets good. And I think it will make this whole overdiagnosis thing click. So get this. They actually looked at whether the cancer was found on a mammogram or if the woman could, like, feel it herself. Palpable tumor.
Okay.
And when they only looked at the palpable tumors, the ones women could feel, Tamoxifen looked even better, like way more effective.
Whoa, really? So if you found your cancer because you felt a lump, tamoxifen was even better at preventing that.
Exactly. It's huge, right?
Yeah.
Because those palpable tumors,
Hmm.
they're less likely to be those tiny ones that might never have caused any trouble.
Right, right.
So it really points to this idea that overdiagnosis is messing with the results of these big trials.
So are you saying that if the trials just focused on the palpable tumors, the ones that are less likely to be overdiagnosed,
Yeah.
we might actually see a much bigger impact on whether women die from breast cancer?
Exactly. We might finally see that these medications can actually save lives, not just prevent diagnoses that might not have been a problem in the first place.
Wow. This brings up some pretty big questions, don't you think, about how we even approach breast cancer prevention in the first place?
Oh, absolutely. If overdiagnosis is as common as some people think, it changes the whole conversation about the risks and benefits of taking these medications.
It's not just about taking a pill to prevent a disease anymore. It's about potentially going through treatments and the stress of a cancer diagnosis for something that might never have hurt you.
Yeah.
That's a lot to think about.
It really is. And it shows just how badly we need more research on this. Like, we need more data, and it needs to be way more detailed.
So where do we go from here? What needs to happen to get those answers?
Well, for one thing, these trials need to be designed differently.
Hmm.
From now on, researchers have got to tell us how they found the cancer. Was it palpable or just on a mammogram?
Yeah. Yeah.
That kind of detail lets us analyze the data in a much deeper way, like in that 1998 trial, remember?
Right, right.
And that's how we start to get a real handle on this overdiagnosis issue.
It seems like this could completely change how we think about breast cancer prevention.
Yeah, it really could. And it's a conversation we need to have. We can't just assume that finding more cancers means saving more lives.
Right, it goes back to that question we started with. Why aren't we seeing these amazing results in the death rates? And overdiagnosis could be a big part of the answer.
You got it. And this is important for women to know. Like, this is potentially life-changing information.
This is where it becomes real, right? If overdiagnosis is happening as much as we think it is, what does that mean for someone who's trying to decide whether to take a medication like tamoxifen?
Right.
What if preventing some cancers actually leads to unnecessary treatment for others?
That is the million-dollar question. And it's not an easy one to answer. Honestly, it's something each person needs to talk to their doctor about. They need to weigh their own situation.
And those conversations, they need to be based on the best, most detailed information out there. That's why these future trials, the ones that clearly tell us how they found the cancer, those are so important.
Totally. Those trials could be game changers.
Yeah.
They could finally give us a clear picture of how well these medications work without all the uncertainty of overdiagnosis.
Right.
We'd know for sure if we're preventing deaths
Yeah.
or just diagnoses. And that knowledge, that's power. That lets women make the best choices for themselves.
This has been
Yeah.
really eye-opening. I'm kind of blown away by all this, honestly.
It's complicated, that's for sure.
It's complicated, that's for sure. And there's so much more research to be done, right?
Yeah, absolutely. This is just the beginning, really. This whole overdiagnosis thing has got researchers scrambling for answers.
Exactly. So for everyone listening, this is your cue to stay curious. Don't be afraid to ask questions and stay informed about the latest research. This is how we all learn and make the best decisions for ourselves.
And remember, you don't have to navigate this alone. There's tons of information out there and people who can help you make sense of it all.
That's so important. If you're feeling overwhelmed or confused, talk to your doctor.
Yes. 1,000 times yes.
They can help you understand what all of this means for you.
Exactly. Your personal risk factors, your family history, your own values and priorities, those all play a role in making these decisions.
They can break down the research and help you figure out the best path forward. And remember, knowledge is power, right?
Absolutely. The more you know about the potential benefits and the risks, the better equipped you'll be to make choices that feel right for you.
This deep dive has been, I've got to say, pretty mind-blowing.
For sure. It really makes you think, doesn't it?
It really does. We've covered a lot of ground today about breast cancer prevention, overdiagnosis, and why this research matters so much. So until next time, keep asking those tough questions.